Welcome, knowledge seekers and professionals, to the channel of the Swiss Journal of Radiology and Nuclear Medicine. A quick heads up, the following audio does not include any images, tables, or other additional information. If you're interested in the following paper, please visit our website listed in the caption below. Now, let's get started. Today, we're going to dive into the scientific publication with the title Role of technetium 99 meters hydroxymethylene diphosphonate bone scintigraphy in the management of neurogenic para-osteo-arthropathies by Sophia Schkicker, Asha Sidoki, and Nadia Ismaili Alawi. Introduction. Neurogenic para-osteo-arthropathies, or heterotopic ossifications, are defined as abnormal osteogenesis occurring in non-skeletal tissues, typically following an initial inflammatory process. These bone formations are not classified as neoplasms and can affect various types of soft tissue. They are commonly associated with central neurological disorders and are rare in cases of peripheral neuropathy. Typically located near limb joints, these ossifications can lead to mechanical complications such as compression of blood vessels or nerves, as well as joint stiffness, significantly impacting locomotor function. Diagnosis of heterotopic ossification relies on standard radiography, although abnormalities may not be evident until up to 4 weeks after disease onset. Bone scintigraphy is considered the preferred method for early detection and maturity assessment of heterotopic ossification. Additionally, complementary SPECT-CT scanning of suspected areas aids in lesion localization, classification, and differential diagnosis from other pathologies. The aim of the study is to elucidate the scintigraphic characteristics and demonstrate the significance of bone scintigraphy, as well as the additional benefits of SPECT-CT in detecting heterotopic ossification. Materials and methods. We present 5 cases of neurogenic para-osteo-arthropathies diagnosed in 2021 at the Nuclear Medicine Department of Hassan II University Hospital in Fez. All patients underwent 2-stage bone scintigraphy following the injection of 743 megabecquerel of hydroxymethylene diphosphonate E labeled with technetium at 99 meters. The imaging protocol consisted of an early study conducted between 0 and 10 minutes post-radiotracer injection, focusing on the region of interest and the adjacent joints, followed by a late study performed 2 to 3 hours later. The late study included whole body scans anteriorly and posteriorly, supplemented by static images. Additionally, suspicious areas underwent SPECT-CT imaging, except in pediatric cases. However, we encountered technical challenges during the scintigraphic examination in 2 patients. In one case, difficulties arose due to joint flexion, which impeded the acquisition of a comprehensive whole-body scan and hindered visualization of all joints, particularly the elbows. In the other case, the patient's agitated neurological state posed challenges during the procedure. Results. Observation 1. A 16-year-old patient with a spinal cord injury, quadriplegic for 6 months, presented with right hip pain. Standard X-ray imaging revealed peri-articular ossifications. Observation 2. A 27-year-old patient experienced a head injury 6 months ago, leading to multifocal joint pain and restricted joint mobility. The bone scintigraphy revealed multiple areas of increased tracer uptake in the early stages, affecting the elbows, hips, and right knee. A supplementary SPECT-CT scan was conducted, revealing the presence of heterotopic ossifications associated with active multifocal neurogenic para-osteo-arthropathies. Observation 3. A 32-year-old patient with a history of hemorrhagic stroke presented with left elbow pain. Skeletal scintigraphy revealed delayed hyperfixation in the right elbow, and SPECT-CT imaging showed mature heterotopic ossification. Observation 4. A 35-year-old patient who underwent surgery for secondary coxarthrosis 2 years ago, including a right total hip replacement, presented with coxalgia and restricted joint mobility. Standard X-ray imaging revealed peri-articular ossifications. A three-phase bone scintigraphy showed delayed hyperfixation, corresponding on SPECT and CT images to a mature bone bridge classified as grade 3 according to Brooker's classification. Discussion. Heterotopic ossification is a severe calcifying condition affecting periarticular tissues and areas, with the potential to involve all joints. According to Chalmers and others, the idiopathogenesis involves three essential factors for the formation of heterotopic ossification: osteogenic precursor cells, inducing agents, and a permissive environment. Uris and others discovered that demineralized bone matrix could induce ectopic bone formation by depositing small bone morphogenetic proteins. These proteins have the capability to transform mesenchymal cells of muscle origin into bone cells under favorable respiratory and nutritional conditions. They also suggest that these proteins are released by normal bone in response to venous stasis, inflammation, or connective tissue diseases associated with bone, situations often seen in immobilization and trauma. The initial stages of heterotopic ossification formation are characterized by the presence of infiltrate with edema and exudative cells, followed by fibroblastic proliferation and osteoid formation, which subsequently matures. Clinical signs of heterotopic ossification may manifest between the 3rd and 12th weeks following musculoskeletal trauma, spinal cord injury, orthopedic surgery, prolonged intensive care stay, or other precipitating events. These signs typically progress through 3 stages: acute pseudo-inflammatory, chronic, and regressive, with eventual symptom disappearance. The most commonly affected areas include the hips, followed by the knees, shoulders, elbows, and rarely the feet. The primary complications associated with heterotopic ossification are loss of joint mobility and function, leading to contractures and ankylosis, as well as other issues like peripheral nerve compression and pressure ulcers. In our patient cohort, the hip was the most frequently affected site, followed by the elbow, knee, and ankle. Heterotopic ossification is unrelated to any abnormalities in phosphor-calcium metabolism. However, alkaline phosphatase levels may rise in the early stages of the disease and decrease as the ossifications mature. Unfortunately, alkaline phosphatase levels cannot reliably indicate the maturity or recurrence of heterotopic ossification, as they may remain within the normal range even in the presence of active heterotopic ossification. None of our patients underwent alkaline phosphatase testing for diagnostic purposes. Standard radiography typically reveals circumferential ossifications with clear centers. However, it may only become positive 4 to 6 weeks after a positive bone scan. On computed tomography, early non-mineralized lesions appear as poorly circumscribed soft tissue hypodensities, which can pose challenges in the differential diagnosis with infectious and tumorous lesions, thereby limiting its specificity in the early stages. Subsequently, calcifications develop, and CD plays a pivotal role in delineating the extent of bone formation and guiding radiotherapy and surgical interventions. Magnetic resonance imaging is utilized to detect contrast enhancement, indicative of residual activity. Three-phase bone scintigraphy is the most sensitive imaging modality for the early detection of heterotopic ossification. Vascular changes can typically be detected as early as 2.5 weeks after the event responsible for heterotopic ossification, whereas osteoblastic activity becomes evident approximately a week later, manifesting as extraskeletal hyperfixations. These scintigraphic abnormalities tend to diminish as the osteomas mature, with activity returning to normal levels around 6 to 12 months. The scintigraphic appearance of heterotopic ossification lacks specificity and may resemble other pathologies, particularly infectious and tumorous conditions. Therefore, completing the evaluation with a SPECT-CT scan is advantageous, as it provides precise anatomical localization of heterotopic ossification and surpasses other imaging modalities in accuracy. Moreover, SPECT-CT facilitates the assessment of heterotopic ossification maturation before surgery to prevent recurrence and allows for the classification of hip disorders according to Brooker and others. Among our 3 patients with hip involvement, 1 exhibited grade 3 heterotopic ossification, while the remaining 2 did not undergo SPECT-CT due to their agitated neurological state and young age. Conclusion: Neurogenic para-Osteo-Arthropathy presents several diagnostic and therapeutic challenges. While the symptoms provide valuable indications, there is currently no biological test for definitive diagnosis of this condition. However, skeletal scintigraphy combined with SPECT-CT allows for early detection of heterotopic ossification, assessment of its maturity, and classification according to Brooker's criteria, thereby guiding treatment decisions. We have come to an end. Thank you for listening in, and until very soon with more interesting publications. If you want to share your own paper in our journal, feel free to contact our team. We are looking forward to hearing from you. Don't forget to like and share if you enjoyed this content. Click the subscribe button so that you don't miss out on future publications from the Swiss Journal of Radiology and Nuclear Medicine. Until next time.